today what I want to talk about is how can we develop and really drive athletes' stability in the lateral trunk, plane, or this frontal plane. And one thing that we already know is that in order to develop a lot of extremity power through the main generators of the shoulders and the hips, so we have to have a good stable position in our core. Meaning, we're not violating the two-hand principle, we're not flexing or overextending, we're here in all our movements. In athletes who are able to do this really well, what we'll see is that they look great when they're doing overhead movements, they're doing push press, thrusters. They've got a good stability, they're not breaking at the rib cage, but they're still lacking when we get them out on the, more of the athletic field, jumping, box jumps, things like that, is that their landing mechanics are off, they're losing some of that lateral stability in their trunk. And what you'll see is that, and studies have borne this out, is that a poor landing here can actually drive a valgus load at the knee, and it's been shown to be an increased risk of ACL injury. So for athletes who are able to generate good stability in the sagittal plane and some of these athletic endeavors, we still need to drive lateral stability, or lateral trunk flexion issues. So a couple things that we can do is really start to lift asymmetrically for some of these things. So for instance, doing like a asymmetrical deadlift or a suitcase deadlift when they're lifting a dumbbell. We see this in CrossFit with, you can be doing some dumbbell snatches where we're coming up and landing here with a good stable trunk. We're not violating the two-hand principle, and we're still now, this external moment is really driving some lateral stability. This is something that I feel strongly about for some of these athletes who do this well. The other thing that we need to keep in mind is, our bodies are wired for movement, not muscles. So to have an athlete lay down and really work on their transversus abdominis or their external or internal obliques or their multifidi really may not serve a lot of purpose in function, because that's not how our bodies are wired for movement. That's not how our bodies are wired. They're wired for movement, not isolated muscle issues. You can look at a lot of this literature comes from stroke patients, and looking at their response and the cortical inputs that are different between moving the hand to the mouth, doing a functional movement versus just a biceps curl. So, and this goes hand in hand too with looking at athletes on stability balls or Swiss balls and having them do presses or military press or any of these kind of athletic movements on a Swiss ball. Well, the problem is, some studies have shown that that's actually decreases the force that they're able to produce through their extremities, because you need a moderately stable ground in order to produce maximal force. And that's what we see in sports. Even in hockey, which is somewhat of an unstable ground, studies have not really benefited working on a lot of stability work on a ball. It's more like asymmetrical Olympic lifts. So, like I showed, overhead, a dumbbell snatch, dumbbell deadlift or a suitcase deadlift, even doing lunges while holding a weight. So, we're here, we got the weight on the opposite leg, even doing lunges like that can really drive glute med, give us some, and really drive some of that lateral stability that we're otherwise kind of lacking sometimes with our straight, pure Olympic lifts. So we always got to keep that in mind. We're always looking at performance. How can I improve performance? How can I improve carryover to the athletic field? All right, we'll see you.